Hey everyone. I hope you're having a wonderful Saturday. It's morning here in Los Angeles, but if you're on the West Coast, good afternoon. My name is Asis, president of the Student National Medical Association. So greetings from LA. Um, I would like to welcome you to this event, Coping with COVID. I know that right now, this pandemic is really affecting a lot of us. A lot of you, I'm sure, are medical students and are being impacted in different ways, from online classes to a halt in clinical experiences. And I wanted to make sure that we were providing all of our membership with just the space to ask questions of folks that are at the table. And so that's kind of how this Coping with COVID event came up. But additionally, one of my main goals for the year is to make sure that there is a lot of programming surrounding mental health. So across the board nationally, there'll be a lot of mental health initiatives, so please stay tuned for that. We have a new subcommittee underneath the Academic Affairs National Committee that is focused on mental health initiatives. So one, I want to give a special thanks to Janice Owens-Walton and Castellucci Nendu, who have stepped up to be the co-chairs of that committee and have helped out with planning this event, and will be doing so for other mental health events that are coming up in the future. So special thank you to you both. And also special thanks to our producers, Dr. Deshaun Hickman and Dr. Abner Murray, who are helping us before they leave us for residency, but we're so proud of you both. So first and foremost, I want to introduce our amazing panelists that are going to be coming through to give us some wisdom and advice on how we can cope with COVID, both on the mental health aspect and on how it is impacting our medical education. So first, I have the pleasure and the honor to introduce Dr. Gary Butts. Dr. Gary Butts is the Chief Diversity and Inclusion Officer, the Director for the Office for Diversity and Inclusion of the Mount Sinai Health System. He is also the Dean of Diversity Programs and Policy and the Director for the Center for Multicultural and Community Affairs at the Icahn School of Medicine at Mount Sinai. Additionally, he is a Region 1 chairperson for the National Medical Association and a pediatrician by training. Thank you for joining us, Dr. Gary Butts.
Thank you for having me.
Yeah. So next, I want to introduce Dr. Nailah Thompson. Dr. Nailah Thompson is an internist by training. She is the director of the Internal Medicine Residency and the Health Equity and Disparities track at Kaiser Permanente, Northern California, based in Oakland. She is also the site director for the Community Medicine and Health Disparities Fellowship. So thank you, Dr. Nailah Thompson, for being with us this morning.
Thank you for having me.
Mm-hmm. And last but not least, I want to introduce to you all Dr. C. Freeman. Dr. C. Freeman is the immediate past president of the Los Angeles County Medical Association. She is the Ethnic Minority Organization Section Trustee for the California Medical Association. She is a member of the Budget and Finance Committee of the Board of Trustees for the American Psychiatric Association. And she is the founding director of the new Charles R. Drew University Psychiatry Residency Program. And also, of course, an adult and geriatric psychiatrist by training. Thank you for being with us this morning, Dr. Freeman.
It's a pleasure.
Yeah, so just for all of the viewers, you can type in questions and we will be getting them live and plugging you all in for the Q&A portion of this event. So one, again, thank you all for being here. I know that the pandemic us all, and that there are different things going on in our lives. So I really appreciate you all for taking the time to be with us today. So first, I think it's important, just in case. Ooh, my eye is watering. Why is that happening? Anyways, just to kind of touch on the basics for those that might be watching that are not too in the know about what is COVID-19. Why don't we just start there? What is COVID-19, and have there been any recent changes in regards to what best practices, just in case we might not be aware of? And we can start with Dr. Butts.
Okay, I'll be real brief because I think that if folk haven't been following and have some appreciation for COVID-19 is, then we've been under a rock. I think the distinction to be made, COVID-19 is the condition that carries symptoms based on the coronavirus. And so we are actually in a coronavirus pandemic, and those who present with symptoms relate to the very specific entity, the COVID-19 species of coronavirus. There are a variety of symptoms that are typical. There are non-traditional presentations that I think most are aware that the more common presentations include fever, chills, and cough, and sometimes body ache. But also, there have been some presentations where only abdominal GI symptoms occur. There have been some who present with loss of smell or taste, and then later go on to perhaps develop fever or not. I think most important is that there are a wide number of individuals who have no symptoms at all, who have been both exposed and have the COVID-19 infection. And that's really what I think leads us to the position that we're in now, and the value of assuming that anyone who you might come in contact with may have COVID-19, and the precautions that we might take, even if we knew somebody for sure had COVID-19, we should take in general. And that includes the social distancing, and of course, if that can happen, then wearing a face cover of some sort. And I really have to push this point home, because some still, and I imagine probably less the case for medical students, but as we've gone to face covering, there's sometimes a false sense of security that actually protects the individual wearing the covering from the virus. That is not the case. One has to have a much better barrier protection that exists in the N95 mask in order to truly be protected from the particulate matter that comes from somebody who has the disease. I think, and then the other, of course, probably more important than anything else, is ensure that we are regularly washing our hands, because the virus does stay on surfaces for a fairly long period of time. And that is probably the most common cause of transmission of the virus, particularly for those who are asymptomatic.
Okay, awesome. Thank you for that. I think, of course, I'm a third year at Michigan State, and so we've had to switch over to virtual electives. We had a 2-week virtual elective where we could kind of choose what we wanted to do. And the next 2-week virtual elective was on COVID-19. So we kind of talked about a lot of the symptoms that we would see in patients and kind of how to treat and the epidemiology of it all. But I think one thing that, that I could start with, that I would like to know, is what changes can we see or expect to see in our education? So I think a lot of us are kind of at this pause right now.
Yeah, I'll start and then pass things along, since I sit in the heart of administration and medical education, and at ICON. And I think this is probably the case for most schools of medicine and DO schools. This was a major, as it landed, particularly here in New York City, which has become the epicenter.
Right.
There have been major disruptions, both with folks' typical professional lives and personal lives. And I think the most immediate response by institutions of higher education, including colleges, but in what we're talking about now, medical schools, has been to pull students from large groups and minimize the risk of exposure. And so that, I think, was an important decision to make. And so most lectures have gone to the virtual or remote access route, and that has taken a lot for some of offering some remote learning. This is a very difficult transition. And so for first and second year, particularly preclinical years, that's been the major change. I don't know that the content, there have been some additional content added on, the quote unquote just in time learning that relates to COVID. So I think you're Your
Mhm.
point is well taken. I think it's important that folks, particularly those in education and medical schools, understand it so they can pass this on to our communities. And then for third years, those students who were more at risk from direct exposure to individuals with COVID-19, there was a decision made in most schools to pull those students who were patient-facing, both inside
Mhm.
of our institutions and out in the community. So those, at least for a while, that happened. The question is, what will happen moving forward as folks become
Yeah.
more comfortable? I think that it is, it's a tough uh, uh, decision to make because just like with the HIV epidemic that many of us have lived through, this is a once in a lifetime event, and for those of you in medical schools now, will be part of how you define yourselves and appreciate your roles. And so to totally cut the cord between this pandemic and not have the opportunity to understand it um, in the moment, I think it's tough. And so as schools become more comfortable, as cities and institutions become more comfortable in ensuring that we're in a position to test, we have good PPE, that there will probably be more and more of an allowance of students to become more directly involved with the care for patients and learning in that way, as you typically do in other situations about COVID and taking care of patients, whether it's
Yeah.
COVID or another infectious disease.
Right.
Finally, the last I'll say is that this has been a great opportunity to reinvest and accelerate some of what schools have been doing with mental health and wellness. And clearly, we all have been impacted by
Mhm.
this pandemic, whether we want to believe it or not. And so it is important that we have resources in place, make it easy for individuals to identify particular students, resources when they need them. And more important than anything else, it's important that we're not shy to access those resources and each other. So I'll
Mhm.
stop.
Yeah. Thank you. Thank you. This is for Dr. Thompson. What do you think that students can be doing or should be doing that can kind of help them to still continue preparing for residency and preparing to stand out?
Well, I think, given this is such an unprecedented time, things can feel a little chaotic. And so I think starting with the basics, it's really important to make sure we're staying on a regular schedule, that we're sleeping the appropriate amount of hours, and that
Yeah.
we're keeping up with our studying. I mean, that's just kind of basic things, but it's actually very important. Our time may be less structured right now, and that could harm us if we're not taking advantage of the time to keep up on our questions and to keep up on our studying. We've had the same sort of issues actually with some of our residents who are at home, to protect them from exposure and making sure that we are able to keep their learning going. Those who are in essential rotations are continuing for the residents, but those who are not are at home. And it's been very important to make sure that we're helping them stay on track. So I would say at the very basics, make sure you're getting your sleep and eating well and exercising. I mean, this is what makes us able to function in our difficult roles. And then
Right.
have a plan, have a schedule. Um, if you are going to be on rotations, stay on the questions and reading on those subjects to keep you up to date. And this is not just, free time. We still have things that we're trying to accomplish. And I think that's just something very basic to think about.
Right.
Yeah. Awesome. Thank you. And I guess we can start off. Well, actually, I had a comment on that. I think you just encouraged me because I think one thing that I have been struggling with is that schedule, is getting a schedule and sticking to it, because I'm supposed to be on surgery, and so in my mind, I had this 5 a.m. to 5 p.m. or whatever, and just sleep and show up. In my mind, and now it's changed to this like 2 hours of virtual, and then just a stack of reading and like UI's questions and things that I have to engage with in a different way. And it seems like the ability to show up is just, or the motivation to show up is a little less. So I definitely needed to hear that. I think it's great coming from a residency, a program director, that it's like, girl, get it together. So thank you for that.
Yeah.
Um, Dr. Freeman, what I think even for me and for a lot of students, we're trying to figure out like how should we like organize our thoughts so that we can be motivated and grateful and I don't know, just more focused during this time, especially when it's really a time where we feel isolated.
Sure.
So just kind of bringing in that mental health piece. What are tips that we can utilize?
Well, I think that it's been made very clear that COVID has essentially upended medical education.
Mhm.
And Dr. Butts made the comment about an opportunity earlier. And I think if we can reframe COVID as an understanding that it's a life-changing event that's essentially created an opportunity to redefine life, that in one degree will certainly ground us. Now, with all of the changes that are occurring and the restrictions, certainly we can see anxiety, fear, and stress escalating. And
Yeah.
all of these things can certainly contribute to the development or the worsening of anxiety and depression. So when you first, I think it's important to recognize that if you're having any of these feelings, well, congratulations, you've just proven that you're a member of the human race. And, to keep in
Mhm.
mind in terms of what you're experiencing is real. And you're not the only one that's experiencing it. Other people are too. So first of all, I think it's important to acknowledge what's going on is chaotic and it is disturbing. Now, beyond that, what do you do? Well, first of all, I think from one perspective, you can practice patience with your educators and understand that there's a new normal that's going to come out of medical education. And nobody knows the answer yet in terms of what that new normal is because we haven't gotten to the end. Understand that your educators are trying to strike a balance between, the risk of your getting exposed and ensuring that you have adequate medical education. And rather than hammer them with a barrage of questions, maybe look online for resources and understand that they too are feeling overwhelmed. You can also limit fear and stress. And what I mean by that is that, use medical students and residents and interns need to recognize just how much power and influence and opportunity you have in the role that um, um, the role that you're living in. You can foster hope by providing truthful information about COVID to family, patients, and basically anyone who would listen. You also need to recognize that many people have recovered from COVID. You also need to recognize that post-COVID, there will be a lot of post-traumatic stress
Yeah, right.
and related to significant loss, whether it be loss of opportunity in terms of a residency program, loss of an interview, loss of the opportunity to take an MCAT in the timeline that you wanted to, loss of a relative. I mean, there are going to be so many losses that I think you can, in part, use this time to educate yourself on post-traumatic stress disorder and the symptoms and the resources that are available. You can also mobilize or develop, if you haven't developed them, effective coping skills. The comment was made earlier, get adequate sleep. It seems like that's um, runs contrary to medical training.
Right.
But we need to recognize, you can't take the best care of someone else if you aren't taking very good care of yourself. So sleep is adequate, is necessary. You need to establish or maintain healthy eating habits. Limit caffeine, avoid tobacco and alcohol. All of those things doctors tell their patients to do that doctors don't do. Those are the things that we need to start doing. Exercise regularly. And you said how to organize yourself. And that wasn't the word that you used, but that's the word I would say in terms of organizing a schedule. And even as erratic as the schedule may seem, if you take scheduled time outs, you will give your mind, a break. And there is a thing called Zoom fatigue. So sometimes you need to get away from the computer and just go do something. I believe people should feed their spirit on a regular basis. You don't wait till the weekend or a vacation to do something that makes you feel good about yourself. And you also want to build support and strengthen relationships. And there are many ways to do that. And I can talk about that at some other point. But those are some of the things that you can do when you're feeling overwhelmed or lost or hopeless. And don't be afraid to reach out to others and reach out and help them. Maybe with a phone call, maybe there's an elderly neighbor you can do some grocery shopping for. There's something that somebody did in my complex, and they went around and delivered 2 rolls of toilet paper at everybody's door. And it was just the thought of, doing something neighborly that, lightened our hearts and made us realize that, yeah, we're all in this together and we'll get through it. And when we come out on the other end, hopefully we'll be in a better place. And I also think it's an opportunity for us to really start having the conversation around how systemic racism, which was the justification for slavery, continues to contribute to health disparities. And we can start looking for solutions.
Because I definitely have experienced that. Dr. Thompson, I'm sorry, did you have something that you wanted to add to that too?
I just wanted to share something that actually helped me with this entire situation. I think we've all been told multiple times that we need to be socially distancing. And I think, as Dr. Freeman just so clearly explained, being isolated for any of us can bring up anxiety, can bring up feelings of depression. And a way that was mentioned to me is to think about it more as physical distancing, and we can still be very social.
Yeah.
And I think that's really important to think about. I personally am in my 3rd trimester, about to have a baby, and have been in my house basically alone for almost 5 weeks just to decrease my risk. And I've been able to connect with people in various ways, by FaceTime, by telephone calls, by Zoom. I've had people drive by and drop things off to me. And I think that helped a lot, even though I can't give someone a hug and I have to be physically distant from them. I don't necessarily have to socially distance. And I think if you think about it that way, it helps a little bit during this difficult time. And I just wanted to say, this is difficult for all of us. It's difficult for students, it's difficult for residents, but it's also difficult for us as, faculty and people and human beings. And so I do agree that we have to get through this together and realize, you're probably not the only one struggling. So I just want to encourage people to think about it more as physical distancing than social distancing.
Yeah, I like that. I think that I've been trying to figure out, I think especially as medical students, my sister and I were both in the same medical, we're both in the same class. I think sometimes we talk about what it looks like to look, I guess, responsible, since we're approaching becoming physicians. So I think it's very important to make that distinction, that we're still practicing exactly what they're saying. So I really do appreciate that. And I think one thing that I actually started doing was doing like Zoom workouts with people.
Mm-hmm.
There's lots of dance parties, Zoom workouts, all kind of things that you can do. And those things are healing and help us to take care of ourselves. So it's been beautiful to see the way that so many different people are sharing their gifts. So if you love to do something, I've seen choirs singing on Zoom and different orchestras. So it's really, I encourage you to, whatever your passions are, try to find that, try to be able to connect with that.
Yeah.
I just want to comment on one, and let me apologize. I missed a lot of. I can't hear all of the audio, but I do want to comment. I think that the a point you made, Dr. Thompson, is really important. And speaking to a few students, and it's our our role, our responsibility to support students staying in touch with each other and ourselves, of course. And and a comment that a student made as we brought them together as the SNMA leadership a week or so ago was that it was great to hear that she, because they're so physically isolated and probably mentally as well, but it was great to hear that it wasn't just her, right? And it's easy when you're isolated physically to feel that you're the only one feeling the way you do, and there's nothing you can do about it. And I think, that's really an important point. And I think it's also important to appreciate that, you know, it's not just this event that stresses people out. Medical school is stressful.
Right.
Patient care is stressful, and I think I think it helps us through this event to be reminded that we need to regularly check in with ourselves and then with others to support us during these stressful times, but in general.
Yeah. Thank you. You all are really giving us a lot of wisdom that I think we needed to continue social distancing and staying at home. We have one question of a student asking about telerotations for medical students who can't complete their core clinical rotations. She just wanted to know, has anyone heard of this, and is it being adopted in medical schools? So maybe Dr. Beth, we could start with you there.
Yeah, I think that we're still trying to figure that out, and certainly um, what's beginning to happen is the bulk of the didactic content is being front loaded or being made available more easily and readily. I think that it still is difficult uh, to have a clinical experience close to the same, although there's some simulation opportunities. And so this is probably more than any year of our school. The clinical years were more disrupted, and it's for those that there was much more difficulty in adapting or making a transition that was suitable. And I think having had an opportunity to do some reimagining of what that could look like as we begin the next season of work, there will be a nation of hope that makes sense and use of simulation. The hope certainly is that certainly by August we're in a much better position, and so with good PPE, I think that questions around clinical contact should be less of a concern.
Awesome, thank you. I think we have another question here. That's kind of giving the voice to a lot of rising fourth years like myself. So I think the gist of the question is that right now there's this worry that we won't be able to go on away rotations and go to interviews in person because just in case that the stay-at-home order is still in place come like August or further on and residency programs start to really like lock down on the amount of people that can come in or whatever. And so I think a lot of us want to know how would we get exposure to these programs, or is there anything creative kind of being done to figure out ways in which students can get this exposure to programs in lieu of these away rotations and in-person interviews?
I can comment on a couple things we're working on. I think, again, there's so much unknown right now, and we also don't know. So we're trying to prepare, as you said, in case students cannot come for interviews. We're trying to make sure that we have video tours to still show the hospitals and our community sites where you would be rotating specifically for the interview season, and organizing kind of Zoom events with the residents and with the faculty to get to know each other, and connecting people, which we try to do anyway, but connecting residents who have similar backgrounds or schools that they've gone to answer questions and kind of being available in this virtual world, which everything is turning to a virtual world right now. I think specifically for the sub-Is, we're in a similar situation, and we are trying to figure out how to continue the learning, making sure it's safe for everyone and also for students who may be rotating. And I think there are a lot of things to consider at that time with cases and numbers of COVID positive patients, also PPE and making sure we have adequate supplies to keep everyone safe. I think it's an evolving situation. And so and it's also different in different areas of the country, of course. And so as we learn more, I think it's going to be important for us to try our best to stay in close contact and be flexible so that we can take advantage of as many of the experiences that we can, but understanding that things may continue to change, which these days they actually seem to be changing almost every day. So I would just encourage you specifically for sub-Is, especially for programs that you're very interested in, be in close contact. We are going forward with scheduling sub-Is, but we are staying in close contacts with those students if they have to change.
Mhm. Yeah, this is Dr. Freeman.
We have, I'll just say, we have, at least for the short run, put a hold on visiting student opportunities to our institution until we can figure out how to address the gap in experiences for our students first, and then secondarily would be visiting students, including the visiting electives program for minority students that we've run for a good decade or so now. So we apologize for that, but first things first, if we can get it straight for our students, then we would feel more comfortable opening the gates for others. And I think your point is well taken, Dr. Thompson. Having good PPE, safety first, I know it's a tough pill to swallow. You come to medical school to learn to be a doctor. There's no other way to become a doctor than the direct hands-on experience, and we recognize it. But we want you to be safe first.
Right.
We want the institutions to be safe, and once we get that straight, then I think it's easier for institutions to be comfortable opening the gates and getting back towards the kind of experiences that you deserve.
Right. Dr. Freeman, I think you had a comment as well.
Yes, I wanted to address that even before COVID-19, many programs did distant interviews or virtual tours, and I just see the trend is likely to continue. I did want to comment that if you aren't performing clinical duties, that time should be spent preparing for exams or even interviews, writing articles or op-eds, acquiring additional skills that will complement your medical expertise. Whether you learn another language, develop some proficiency in public speaking, do a certificate program in public health or diversity and inclusion, wellness, develop an expertise in utilization review, or even business management. You can use that time constructively, which will likely, so you're directing your energy to something that will produce some outcome, will also help in terms of reducing your anxiety.
Yeah, awesome. Thank you so much. I think one thing that I'm doing is definitely trying to, one, work on my personal statement. Don't want to leave that till the end. Update my CV as it's getting closer to application season. And also, I think right now social media is a great outlet in order for us to just educate our friends and our families and those that just happen to be tuning in that we may not know. So I think social media is kind of one way that I'm trying to learn more about and trying to focus and really building. So I think that's a great piece. I was supposed to be speaking Spanish, but let me get my schedule down first and get to studying very consistently before I try to add in my language component. We do have another question that I think is it really resonates with me. But Pamela Meadows put out a comment with per existing struggles addressing mental health issues in your communities, what challenges do you perceive in addressing PTSD for those types of communities? So, we could start with Dr. Freeman.
Yeah, well, first of all, I think the mental health system is going to be overwhelmed. It already is overwhelmed.
Hmm.
I think that many people are not going to be able to recognize that what they're experiencing is post-traumatic stress disorder or symptoms consistent with that. And so I think there, again, is an opportunity for the collective to address that particular issue. And I need to step away for a moment.
Okay.
Hi, it's Dr. Thompson. I can follow up with something on that. I think know that um, that mental health, first of all, is often overwhelmed, and that our primary care providers do a lot of mental health work. And I think, especially for mental health, as in all health, but it's important for there to be trust and relationship. And sometimes in communities of colors, that's lacking.
Hmm.
I think if we know that everyone won't be able to access necessarily a psychiatrist or a psychologist, what are other things we can do? Thinking about educational campaigns in our communities of color and trying to normalize things like PTSD, anxiety, depression, and continuing, which we've been trying to do for many, many years, to break the stigma around these issues and break the idea that we need to all just push through and be tough and be, super women and supermen and superheroes when we're struggling. And so I think thinking about ways we can do educational campaigns and continue to normalize these issues is really important and may help people feel a little bit more comfortable. Our patients, us, anybody in our community feel more comfortable to admit when we're having these feelings or recognize them and then seek help.
Yeah, I'm just going to add, I can add to that. I think just like a comment earlier about normalizing the experience of an individual student, this is a great opportunity to normalize a lot of this, right? Because these stress is not new, mental health challenges aren't new. I think perhaps we can use this pandemic and what we're learning and seeing to push out the messaging a little bit more differently, and so that folk in our community, particularly people of color, recognize it's okay not to feel good at times because you have a reason not to feel great, and this is what you can do. I think a challenge, and this is not just about the mental health service using technology, and there's a lot of out there now, and I think if it's not been shared through SNMA, there's a boatload of technical apps, among others, that information that can be shared to be used for students and other folk in our communities. I think they're taking advantage of it. The challenge, though, is that the technical capacity is disproportionately missing in our communities of color and in poor communities, and that impacts on the advantage we might make as we ramp up telemedicine, telehealth, telebehavioral health. It's an issue, and I can tell you, I've done two personally. I've had two physician visits by telemedicine, and frankly, in my opinion, they were just thoroughly underwhelming. And I think that we need to do better. This is a time to innovate that space. I think for our student entrepreneurs, this is to the degree you have some spare time when you're not online Zooming for classwork, to think about how you can, in some more relevant ways that can address some of the gaps in our communities. This is a time to begin thinking about that, particularly since it's not going to be about looking back. And business as usual won't be what it was. We're going to be taking more and more advantage of technology, including telemedicine, telehealth. So there's a risk that we will open the gap further rather than close it with access to care, access to services, if we're not very particular addressing some of these concerns in our poor communities and our communities of color.
Wow. Yeah, that's definitely a great point. That's a great point. I think especially one of the things that I was seeing as schools were shutting down, that goes from elementary on, was that students that didn't have access to laptops couldn't be able to really be engaged in their coursework either. So I think that's something that we're already starting to see the effects of it now. So I think that's important for you to bring up for us as future physicians and as future physician leaders, to start maybe even thinking of ways in which we can help in that way. So thank you for that. We do have one other question that I see here from Jasmine Brown. So her question was more so, she's taken 2 years off and is going to be starting medical school in the fall. And so just if medical school in the fall is online, she wanted to know if you all have any tips on how incoming medical students can cope with that challenge of transitioning into medical school, into something new. So this can even be for those of us that are fourth years that are graduating and transitioning into residency even in this time.
Yeah, I'll begin by saying most important. I think that schools are gearing up, and probably residency programs as well, to prepare for that. And so part of the quote unquote virtual orientation, which will be at place at most places still, will include resources to address well-being. So I think it's important to know, ask the question, know, look for the resources online. There's no excuse. There's a lot out there now. We've had a major effort in our institution, first with students and now with students and residents, to first uncover and with a really deep dive issues that address, that impact wellness, well-being on our campus, across our campuses, and then begin to put some initiatives in place. So there's a lot going on now, and they've been accelerated over the past weeks, months, as a result of what we're experiencing or anticipate. And in fact, we're about to launch any day now a PTSD center. That's how
Oh, wow.
significant the issue is. We're already experiencing amongst some of our staff, particularly frontline folk, symptoms of PTSD. And some would suggest that easily 40 to 50% of the frontliners will experience substantial PTSD, and there are other behaviors that would say everybody's going to experience it in one way or another. So resources are out there, understand where they are, and then on the other side, ensure that you have a reasonable support system, just like you would think about. I would suggest this to students transitioning to residency anyway. You gotta, I think it is important to have a support system, because just like medical school, residency training is fairly, can be stressful.
Awesome. Thank you, Dr. Butts. Just to keep bringing in some more questions, and they all kind of have the same similar tones. I think there's a lot of speculation on how it's affecting and halting a lot of things that are going on. So pulling in from some of our viewers on Instagram, what advice do you have for students that are currently in limbo studying for step 1 and, like myself, studying for step 2 CK? I think some things that I've just been trying to think about is looking at what my ideal timeline would be and trying to figure out, okay, now, so if there is a shift, should I take a break now? Like, how should I better utilize my time so that I don't burn out? Yeah, so what ideas do you all have?
I would just,
Please go ahead.
Yeah, no, I would say, I think that, again, keeping a schedule is important. And something you said, or so say earlier, was not waiting till the last minute for things. So kind of spreading things out. I think that, of course, if the timeline shifts and we're not aware, we have to be able to prepare for longer periods of times. So making sure that you're still exercising as well and doing other things, that you're kind of not just burning yourself out, making sure that you're aware of the different types of resources for studying, so that you're not just using one resource, because that can also cause burnout. But continuing to stay the course and understanding that, right now, if you're studying for step 1 or you're studying for step 2 CK, or whatever you're studying for, that's really kind of your job right now. In addition to whatever virtual learning you may be doing, and scheduling those study times. I'm a big scheduler. After having been a Division I athlete, I had to schedule everything. So I scheduled when I studied for everything into my schedule. And I encourage people to think about that. Have your calendar and schedule your workouts in, schedule your breaks in, so that because it's easy, especially when you're home, more to get distracted and think of a project you might need to do and watch one extra Netflix show. So just really thinking about the long term and how you can spread these things out but staying engaged and keeping your knowledge up.
That's so well said. I think that
Yeah.
you gotta, and for those of us, and I'm working mostly remote now, but I'm doing my regular job, overseeing staff remotely, COVID related stuff, trying to stay in touch with students and residents and faculty. And so it is, triple time. And if I didn't plug in at least 30 minutes a day to breathe, and then maybe even eat something every now and then, this would not be possible. So you have to build it in, take it seriously. And by the way, that's an important reminder for even when we're not under a pandemic, right?
Right.
And time management is critical. Right? Write down, keep the list, and stick to it. And that's a good set of recommendations for medical students, for training, and for folk who are applying to medical school. So I have folk, well, what about the MCAT? MCAT is pushed back, blah, blah, blah. Have a contingency plan. Assume that things are going to be on time and be ready for that, should that happen. And if not, then you can always transition, all right? And so that's basically our approach with the medical school. We have some best case and some worst case scenarios that we worked up. So that because things may be delayed substantially, we need to be prepared for all of that at every level, and then as thoughtfully as we can be.
Yeah. I think one thing our outgoing chair, Jonathan Smiley, has said in a lot of our board meetings was that pivot is the word for the year. And I think that once all of this started to happen, in terms like we had to cancel our annual medical education conference, the in-person planning of it, we had to be removed from our clerkships. I think that I had to take like a good 24 to 48 hours and just sit on the couch because I could control the fact that I can sit here right now and just pause. Because I think sometimes it takes you might have a little bit of cushion time for that adjustment to be made. So I think that now I'm starting to get back into the swing of things, and things are starting to feel normal again. So I think the next step that I know I'm going to take is for all of my friends that are watching, I'm going to be reaching out because we're going to have a plan your week Zoom session so that I can get organized for this coming week. Because I think too, one of the things that kind of happens is again, speaking for myself, is that I'll plan out in my head maybe what the week might look like, or even what the day might look like, and not necessarily write it down. Reach the end of the day not hitting every single thing that I had thought about, and then feel worse, and then start the next day feeling worse than I did the day before. So I think a lot of the points that I'm taking away is, one, try to plan out your day, plan out your breaks, plan out time to exercise and those things. And also just try to maintain a grateful mindset that you're doing something still towards your goals. You're not just sitting there at a pause. Another question that we have received from Instagram, again, it's like this nervousness about getting all the components in for residency, whether it's the letters that we need, but now we're not in clerkships anymore. So what kind of advice could you give? I guess let's talk about specifics about getting letters of recommendation right now that we're not in clinic right now. So how should we approach that? It's a hard question.
I would say, I think, so for those who are starting their fourth year, you're going to have to reach out to those that you've already done. And I think we understand that we understand what's going on, and we understand that people aren't doing their rotations right now. And so I would encourage you to reach out to those from your third year that you feel would be helpful. I think, I would say specifically, for many programs, there's been a shift in looking at kind of holistic review. And so that, letters of recommendation are important, but they're not going to be the only thing. And so we understand if we're getting more things from a limited amount of time, we understand that. We're wanting to look at the whole picture and what those letters do say. But I think I would think of the whole thing. So as you're putting your statements together, as you're putting your applications together, make sure that you are not only focused on the letters, you're not only focused on the board scores. Those are important, but we want to know what makes you different, what makes you unique, and how your life story and your experience have shaped you to want to be a physician and the specific specialty you're choosing. I feel like sometimes people get really stuck on just the specifics of a letter or your board scores or your grades. Those are all important, but remember to highlight what in you makes you different than other people who are applying, because most people have good grades and have good letters. And sometimes the letters can be honestly not too unique to the person. So get your letters, definitely, but make sure you have your application telling your story and highlighting what is important that we know about you. It might be somewhere you volunteered. It might be a job you had before you went to medical school. It might be that you were a dancer. There's all different things that are on a team. I was a basketball player, and so that was a lot about being on a team that I was able to bring into my application. So think about what makes you unique and make sure your application tells that story.
Awesome. Thank you. I think that's something that I've been talking about with my friend group, is like just trying to make sure at least that your story is told in a way that allows programs or whoever's reading it to see that you are a complete individual outside of medicine. Of course, you're coming in trying to show that you're clinically excellent and prepared to go into residency, but it's really important to show those other aspects of yourself that will also help you to stand out. So awesome. Thank you for that. We have some additional questions. One, welcome back, Dr. Freeman. But one question that someone asked were, what are some good books or sources to learn further about health disparities and ways to grow as a person or as a future physician? So I think you guys can maybe just shout out some of your favorite books that you feel have helped you along your journey. And hopefully someone will write them out in the comments so everyone can see them, so I can see them for later.
Yeah, if I can just a quick comment before folks get into the resources.
Okay.
Now more than ever, okay, we have to tune in to the disparities conversation to figure out ways to elucidate the issues and address them, right? And so this is yet another way to leverage this pandemic. What's being uncovered now, this is not what we're seeing with what's not the best data yet is alarming. And we should not be comfortable at all or become stagnant. This is a reminder that there are deeply rooted issues that still need to be addressed. And we have commitment and obligation, particularly the people of color, and others, frankly, so that we can ensure that the policies, the ways in which we address our priorities as institutions and as individuals are much better aligned with the clear needs of our communities and what's getting in the way. Right? This is not an issue of biology that's separating people of color from others. It is or having disproportionately more Black and Latinos die from COVID-19. It's all the other things, the structural and social determinants that have led to the differences and the variations in care and outcome that have existed for far too long. They have to be addressed. We have a role to play. NMA has pushed out some messaging around this, as have others, the AMA, et cetera, et cetera. We need to understand, and I think that this is a great opportunity for those who aren't quite sure what to do, if indeed there's any downtime, to connect with resources, to connect with individuals who are studying these issues, and more importantly, to participate in leadership or influencing leadership through your perspectives to begin to address these issues square on.
Awesome. Thank you. And so for those books, what can we be reading?
Well, I'd like to offer a list. I think you should first start with White Rage uh, by Carol Anderson. Then I would follow that up with White Fragility.
Mm,
And then you can add several on to that, such as Why Are All the Black Kids Sitting Together in the Cafeteria? Understanding Race, Ethnicity, and Power. The New Jim Crow.
mm-hmm.
And by reading these books, it'll give you the historical foundation that will help you be able to address the issues. What I like about White Fragility is that it is a book that was written for white folk by someone who was white to educate them about their defensive response to any comment about racism or slavery. And I think what's good about that particular book is it helps you understand uh, the other person's perspective and the challenges that they have. And if you understand their mind constructs, then that's something that you can work with. And beyond just talking about or the fact that it exists, I think the issue here is really looking at long term solutions and recognizing that the structural racism, again, racism was made up as an excuse for slavery, has impacted everyone and has really compromised this country's ability to maximize its growth potential. And I said earlier, as students, residents, and interns, you're really in a very, very powerful position to affect change and actually get people to listen to you. I'm a firm believer in organized medicine, so my hat goes off to SNMA, which was a training ground for me as a leader because I was national parliamentarian at one point in time. Not a popular job, but someone has to do it. And that served as an opportunity for me to then go on to the NMA and hold a national position there and the other organizations. So I also think it's important that you educate yourself from a historical perspective so that you can understand why things are the way they are. And then you can become part of the solution by becoming involved in larger entities, whether it be your county medical association, your state medical association, your specialty association, and do it now because once you start working, you'll even have less time. So again, I think those are some things that you can read and become literate in terms of being able to engage with others from an educational perspective and have that fund of knowledge where you can help them see that something different needs to be done and together you can figure out a way how to do it.
Awesome.
So I just wanted to add, I agree with all of that, and many of those books I would have recommended. I think we can, the other thing we can think about is looking at the disparities that exist in the areas where we are, and your public health department can be helpful with that, and looking at the actual hotspot maps for the areas where you are that look at not only medical health disparities, but also social disparities and how those things overlay. And I think that's important to the discussion that Dr. Freeman was just talking about systemic and institutional racism and how those things have persisted for years and how it continues to be disparities in not only diabetes and hypertension and heart disease and COVID, but also poverty, obesity, access to healthy food. So I encourage you to learn more about the areas where you are. And you can look online on your public health department's websites and look at the maps for that. I wanted to just briefly touch on something a little bit different in how we can prepare ourselves for some of the things we as people of color will face, unfortunately, for the rest of our lives. regarding bias, regarding racism, regarding microaggressions, and make sure that we are aware how to deal with these situations when they happen. I think, unfortunately, sometimes when these things happen, our emotions rise up, and it's a little bit more difficult to deal with. And so I encourage you guys to really read more about these things and be prepared that, unfortunately, even though you're a medical student, even though you're a physician, these things are still going to happen. And so in addition to learning about health disparities, learning about how we can respond to these microaggressions and also know the safe places in your organizations to go when they happen is really important.
Yeah, I don't have a lot more to add. Thank you for those thoughts. Except, I mean, of course, there's some classics that have become classic, even though they're not so old. But Harry Washington's work, Medical Apartheid, Henrietta Lacks, which most people have probably or should have read by now, which really helps folk to appreciate the system in which we're being educated and trained. And I think more important is to appreciate that while it is a tax, right? We do have to do more. We need at least to know if indeed we're going to be positioned to educate others, right? So that does imply that there's more work for us to do. But folk are going to sometimes ask what to do, right? Because the data are important to capture, to inform what we do. But I think it is important that we're in a position to offer some thoughts. You all as students are more powerful than you think, than you probably think in our institutions. And it's not just because you pay tuition, but we have an obligation to educate you, to ground you in a foundation that's going to have you impact others on our behalf, right?
Yeah.
So, let's make sure that you're optimally informed, that you are positioned in SNMA and NMA and AMA to the degree that you relate to any of those can help in those regards because they are legitimate organizations and they also can help with policy positions. Right? And so it's what we do with it that's going to make the difference. And so that when all this is when things are better with coronavirus, these old issues will still be in our faces, right? And so I think more than anything else, hopefully we will be better positioned to address the old issues as we get through recovery with COVID-19. And we all have a role to play with this.
Right. Awesome. Well, thank you all for those comments. I know we have a book list that was now created. There was one other that I know I did want to add, Crucial Conversations. That book came to mind when you talk about trying to be prepared to navigate these conversations as we go on in our education. We're going to just take one last question and then wrap up with some final comments here. One from Bianca. Can you give any tips on discussing mental health with older members in our community, especially with those of us who have older parents, aunts, uncles, or just our older family members?
Mm-hmm. Yeah, I'd like to speak on that. Oftentimes, older people do have their religious leaders that they lean on. And to be able to engage with them is one way that they can address mental health issues. One of the coping skills in terms of managing stress may have actually been going to church or engaging in some religious ritual that they no longer are able to do with as much regularity. But I also know that many services are now provided online. So being able to help introduce them to being able to use technology as a way to maintain social communication, that is one thing to do. Again, the comment earlier about the difference between social distancing and physical distancing. You can still be safe, but one of the things that I have found very helpful that I've just been doing is I've been talking to people, friends, relatives, mentors, by telephone or by using any of the, video apps, just reaching out and asking how they're doing, not really asking for anything in return, just checking in to see how they're doing. And maybe that's something that you can do. And maybe put yourself on a schedule to call them, once a week or every other day, or develop a collective where if there's a large group of family members that you could rotate making contacts with them by telephone or dropping something off on the doorstep. That's one way that you can engage with them. And there is a collective that is not used to talking about feelings, but maybe you can talk about experiences. And depending on their age, you may be able to tap into an experience that's akin to what we're going through now. And by talking about that previous experience, you may be able to then get them to tap into some feelings or what they remembered or how they handled it. And if you can stir up reminders in terms of how they've endured other stressors, then that will cue them in terms of being able to handle this stressor too. And being able to handle stressors and live beyond that and function effectively is really what we call resilience. And generally speaking, we in general are a resilient culture because we've endured many, many things that are traumatic. However, I think, again, if you look at it as an opportunity, you can definitely reframe it in a way that you could create a productive outcome. Understanding, though, that there is definitely going to be a lot of loss that's going to be experienced. But if you can try to get people to talk about how they've handled loss in the past and how they've been able to overcome it, you can remind them again that they'll be able to overcome this. And you can learn from them. People love to tell stories. And you just need to be a good listener.
Awesome. Thank you so much, Dr. Freeman. That is all the time that I want to take from you all on this Saturday. So I just really want to thank you so much for taking the time to really share of your wisdom for our members and any other watchers out there. So we really, really thank you. For those of you that are live with us on Facebook, we are going to collect all of the other books that were recommended and make a reading list infographic that we can share with you all from the books that our awesome panelists shared with us as well today. Those infographics are going to be posted on our Instagram, on our Twitter, on our Facebook. So what does that mean for you? Follow us on Instagram at SNMA_official. Follow us on Twitter at SNMA and follow us here on Facebook so you can continue to get that content. But most importantly, if you are not a member of the SNMA and you are a pre-medical student or you are a medical student, please, please, please become a member so you can really reap the benefits of all we have to offer. Additionally, we're going to post a QR code on the screen that will take you to a really short form that we would love for you all to fill out that will give us some feedback on how we did. Did you find this program useful? And if you could give us any areas of improvement as well, that would be really appreciated. Again, it is part of my program for my national programs to really focus on mental health, really as it affects us as future providers and as students. And so we want to make sure that we are taking your concerns into consideration as we go about planning out the year. So please take a second to utilize that QR code. We'll also put the link just in case you are not QR code savvy. I literally just figured out how to use that like last weekend at our virtual conference. So please make sure you fill out that link, give us some feedback. Again, thank you for taking the time to sit with us and engage in conversation with us this weekend. I appreciate you. The SNMA appreciates you. Have a great Saturday. Bye, y'all. Oh, and thanks to those of you that told me I had lipstick on my teeth. We don't want that. Bye.